Hey, Hosa, my name's Aileen,
My name's Evelyn.
And my name is Mariah.
and today we'll be talking about normalizing mental health.
So, what is normalizing mental health and what does it look like? Well, for us, we hope that we can make mental health conversations more common and discussed about. We hope to reduce stigma so people feel more comfortable seeking help and educating others to promote an understanding and acceptance. There's tons of benefits in normalizing mental health, like encouraging open dialogue so that shame isn't brought up onto that person. And it really just promotes an overall mental well being in people surrounding you.
So, for our target audience, we chose our peers, and we chose our peers because during our age group, we face a lot of emotional and social development, and we face a lot of challenges like academic pressure, relationship dynamics, identity formation, and a lot more, which all is affected by the social media. And this can affect our mental well-being. By addressing health to our age group, we hope to help normalize the conversation and provide the proper resources and tools to manage stress, anxiety, and other common mental health issues. And we also aim to reduce stigma, promote awareness, and offer support.
So, what is mental health? According to the World Health Organization, mental health is the state of your mental well being and allows people to cope with the stresses of their life no matter what the situation is. It allows you to realize your abilities in helping yourself and peers, learning to work well with others, and also just contributing to your community as one. So, mental health in the daily life. We decided to choose these because they are more common. Depression and anxiety are an everyday mental health disorder, and depression can look different than anxiety. It's based on difficult tasks that shouldn't have been difficult in the first place, like getting out of bed, hygiene, communicating with others. And then anxiety is just an excessive amount of fear, whether it's for a good reason or not. It could be real world situations. PTSD is a little more extreme, as well as bipolar disorder. Um, it normally takes place when a person goes through a traumatic event, and then the after effects is what PTSD is. Bipolar disorder, it focuses more on a person's emotional state. The highs are extremely high, the lows are really low. There's never really an in between, making it difficult to be around that person.
Okay, so now we're going to go a little more in depth about depression. As we said, depression is a common mental disorder and it involves being in a depressed mood, loss of satisfaction of things you might have loved doing before, decreased energy, and depression can happen to anyone. But these people are just mostly commonly affected by this. People who have lived through abuse, severe losses, and stressful events. Depression symptoms can be shown as poor concentration, feelings of excessive guilt or low self-worth, hopelessness about the future, thoughts of dying or suicide, disrupted sleep, changes in appetite or weight, and feeling very tired or low in energy. So some effective psychological treatments for depression could be behavior activation, cognitive behavioral therapy, interpersonal psychotherapy, and problem solving therapy. And every 1 in 4 adults experience depression each year. So this is a demographic about the overview of depression in 2023. A study conducted in March of 2023 by the World Health Organization estimated that depression is a part of a large portion of the global population, affecting around 280 million people worldwide. In 2023, these countries had the highest depression rates, Greenland being at the top with 6.61%, followed by Greece, Spain, Portugal, Palestine, and Tunisia. And some examples of why these depression rates went up were because of social economic status, sexual orientation and gender identity, and racial and ethical groups.
Okay, so let's dive deeper into what anxiety is, since it is one of the more common mental health disorders that we see every day. It's defined as the excessive amount of fear or worry. It could be for situations that are real or perceived as a threat, leading to avoidance and negative physical symptoms. These symptoms can include excessive fear or worry, constantly being on edge or even irritated, rapid heartbeats, shaking, feeling a little uneasy, abdominal discomfort, nausea. The list goes on, but there are treatments. Some people prefer to go untreated. If that works for you, then that's fine. But there's also therapies. There are prescribed medications, and then if that's not for you, there's also more lightweight therapies like aromatherapy.
So, our next topic is bipolar disorder. And for bipolar disorder, it's a mental health condition which is commonly signified by extreme mood swings that, like Maria said, include emotional highs and lows. Bipolar disorder can affect not only just your energy levels, but it also affects your thought patterns, your behavior, and your daily functioning. And it doesn't just affect you, but it affects the people around you. And there's a lot of different types of treatment for bipolar disorder, but they all require the treatment to be long term. So first we have the first option is medication. For medication, there's options such as antidepressants and antipsychotics, and for therapy, there's like psychotherapy and family therapy. And for lifestyle, you can just change your diet, your um, the amount of social activities that you do, like interacting with people, exercising, and just like a lot of, and doing a lot of self care. And that doesn't just help you when you have bipolar disorder or a mental health condition. Just anytime you feel like sad or down, you can do any of these.
So, like Aileen said, I want to talk a little bit more about self-care. I can't stress enough how important it is to make sure that self-care is implemented into your daily lives, especially for our targeted audience from 14 to 18. High school can get extremely rough. I know that personally, I've had my struggles. And we really just hope to promote a community where your relationships are improved, stigma is reduced, and then increasing resilience within yourselves and your peers, and even saving lives. There are tons of strategies that you can use. Feel free to find whatever fits you best. It may take some time. There's things like exercise and sleep, journaling, talking with friends. There's also therapy and online resources that can get you the help you need. And then things like practicing affirmations. They're lighter, but it can make a difference.
Okay, so we're going to talk about what stigma is. Stigma is society's negative belief and stereotypes about a certain topic or situation. In this case, it's mental health. Some examples of stigma that occur within mental health could be like the phrases that are said, you're crazy, or she's schizophrenic, and reaching out can even be seen as a weakness, and people can be considered comical, scary, and incompetent. Media can play a huge part of strengthening stigma by showing inaccurate stereotypes about people with a mental illness, connecting mental illness to criminal behaviors and violence, and wrongly using mental health diagnosis to explain behaviors. Within mental health, and usually men may be more vulnerable to be stigmatized, to be treated with stigmatized attitudes and beliefs toward mental illness because experiencing a mental disorder violates gender ideals, including masculine strength and self-resilience, by assigning weakness and dependence to them.
So how do we stop the stigma? So to stop the stigma, we really have to have a better understanding of what the stigma is. And with that comes that there's two different types of stigma, one being social stigma and self stigma. Social stigma is a stereotype instilled by society related to mental health, affecting various opportunities, including work opportunities and school opportunities, and relationships, whether it be friendships or family relationships, it can affect it all. So social stigma is more like what Evelyn had mentioned in the slide before, like, oh, she's crazy or she's weird, and making like invalidating you because you want to share your feelings or talk about opening up more. And self stigma is a more internalized stereotype, causing you to feel shameful, unworthy, or avoidant towards treatment because you feel that, oh, if I talk about my feelings, I'm going to show that I'm weak or that I'm going to be weird, you know? And to end mental health stigma, we can educate ourselves and others just how we educate ourselves to help our peers so they could share the information and listen and support others and show a lot of care and compassion. Sometimes all we need is just to know that somebody has our back. So, how to get help or how to provide help? Obviously, this isn't a very easy conversation to have someone. It takes a lot to be able to talk to somebody about mental health, especially with the stigma that we have around it. So, if you or somebody needs help, you call or text 988, which is a suicide hotline number, and in life-threatening situations, call 911. And you can also talk to a trusted adult, and here we have some examples. You could also talk to a friend, and your friend could go to a trusted adult. And how to provide help. Try to be understanding. It obviously, like I mentioned before, isn't an easy conversation to have with somebody. So if somebody goes to you, you have to stay with the person. Like I also mentioned earlier, sometimes we just need to know that somebody has our back and listen to them, make eye contact, like nod, make sure you're really listening and you're not cutting them off, just so they really feel heard. And talk to a trusted adult and get help immediately. And never promise secrecy, always speak up. I like to say that it's better to speak up and be wrong when you notice a warning sign than to stay quiet and be right and put your friend's life in danger.
Okay, our call to action was 2 pre-assessment surveys. One was before and one was after. We asked that our targeted audience would scan the QR code and it would direct them to the survey and they would give us our feedback. As hosted students, it's important for us to make sure that our targeted audience was able to understand and comprehend what we're talking about and to help us improve better for in the future. And then our purpose was to normalize mental health, focusing more on your emotional well-being. We wanted to address the widespread stigma surrounding mental health discussions, making it a little bit easier. We believe that if you prioritize your emotional well-being, it's better for your overall health. We hope to encourage everyday individuals to advocate for not just yourselves, but your peers as well. We really just want to make a positive impact on you guys, people on campus, and our future settings.
Okay, so now we're going to talk about our perspectives involving mental health. We're going to be getting more into depth of how mental health has impacted our lives personally and how they will continue to impact our lives in the future as we go into the healthcare field. So for me, mental health has played a very tremendous, huge part in my life. As an older sister and a student, it's important for me to know how mental health affects one, so I can learn how to manage my emotions when I'm feeling overwhelmed or stressed. It also helps me support my loved ones and peers, and it also helps me balance my responsibilities effectively. So going into the future, every workspace, no matter their focus area, should be able to go through with normalizing mental health. For me, my future profession that I want to head towards is a nurse midwife. Some of the benefits that could happen because of mental health would be helping decrease shame, understanding how mental health impacts pregnancy, birth, and postpartum experiences, recognizing the warning signs and preventing mental health obstacles, building the trust with the patients and the families, to be able to support these families.
So my perspective involving mental health, as a dedicated neonatal nurse, I think it's important for me to prioritize my emotional well-being, considering that in that career path, it can get hard for me emotionally. So I think as long as I know how to advocate for myself, that's the step to providing good care, and then also just changing lives for the better and helping families that are going through a rough time. As for now, I think that mental health allows me to advocate for myself and peers. It's important for me to make sure that the people I care about are cared for. And for the future, I think stress management is just a really important role that'll play into my life, and it'll help me provide extending personal care for families, friends that are going through challenging times.
So my perspective involving mental health currently is I'm very family oriented, and I would like to be able to provide as much help towards my family and my peers and my friends as much as they need it. I would love to be somebody that they could come to if they ever needed help, and know that I will always have their back and advocate for them. And I also think it's important to advocate for myself and know my limits and know when I need to do self care, and kind of step back a little bit from all the stress and overwhelming that I get. But in my career path that I want to take, which is as a pediatric nurse, I would love to strengthen my knowledge on mental health my patients to help my patients understand what they're going through and recognize their mental health issues when I see warning signs approaching, and help, well, not just helping them, but also helping their parents understand and breaking the stigma. If there's a stigma around for us, I can only imagine how it was in their times. They didn't probably have not even half the resources that we have now, or were even able to talk even a little bit about how we do. They were probably not even able to talk about their feelings. Also, I would like to improve, it would help me improve my communication with my patients. I feel like I would have a better understanding of what they are going through and how I can help them, and just make sure that they know that it's okay to not be okay. And I could also apply my strategies to reduce burnout in any career path, in especially the medical field. There's a lot of stress and burnout because it's just you're taking care of other people and their life could be possibly in your hands. So I think knowing that what I do know, I can apply that to kind of help me be at a calmer state and help my patients better, and also have a better response to behavior outbursts, and know that they're not just having a tantrum to throw a tantrum, that it could be much deeper into their emotional feelings with that.
And that concludes our presentation on normalizing mental health and emotional well-being. Thank you.